I don't care sinong magalit sa akin. My only concern is huwag na huwag lang magalit ang presidente sa akin.
The president's marching orders?
No drugs. No guns. Stop agricultural smuggling.
As the pandemic brought global logistics nightmares, the Bureau makes an appeal before overseas Filipino workers who send balikbayan boxes home.
Pagbukas natin doon sa container van, isisegregate na yan by address. Kung saan yung para sa Mindanao, sisegregate yan. Kung saan yung para sa Visayas, kung saan yung para sa Luzon, so that there will be a systematic delivery ng mga boxes na yun. Pagpasensya niyo lang, but we will strive na by end of September, ma-deliver natin ito lahat. 90% na nga yung delivery natin, yung first set ng containers na nabuksan natin.
Lois Calderon, CNN Philippines.
The newly created Department of Migrant Workers, or DMW, takes shape with more officials appointed to key positions. These include actor and TV host Arnel Ignacio. President Marcos appointed him as the chief of the Overseas Workers Welfare Administration, or OWA, an attached agency of the DMW. Ignacio previously served as OWA Deputy Executive Director and Deputy Administrator during the Duterte administration. He replaces Hans Kakdak, who will now be one of 4 new undersecretaries of the DMW. Bernard Olalia, also appointed as DMW Undersecretary. He will continue serving as officer in charge of the Philippine Overseas Employment Administration until the DMW is deemed fully constituted upon the approval of the 2023 budget. Previously under the Labor Department, the POEA is now under the DMW. Overseas, the death toll from the record rainfall in South Korea rises to 9 as forecasters warn of more bad weather. Seoul officials confirming 2 of the fatalities were Chinese nationals. 17 people were injured, at least 7 others remain missing. Forecasters say the downpour eased on Wednesday, but flooded areas may see stronger rains on Thursday. No reports so far of Filipinos affected by the flooding in Seoul and nearby areas, but embassy officials are monitoring the situation. The nation bid farewell to former President Fidel Valdez Ramos as he was laid to rest at the Libingan ng Mga Bayani Tuesday. But tonight on Politics as Usual, we continue to honor FVR, not as the former leader, but as a family man through his grandchildren's eyes. Join me later as Sam Ramos-Jones, Patrick Halasco, and CJ Sembrano, often called FVR Liit, tells us stories about their Lolo Eddie and their new mission to keep his legacy alive. That's at 8 p.m. only here on CNN Philippines. More stories ahead on Newsnight. Meralco wins against San Miguel in today's PBA Philippine Cup semifinals game, while the Magnolia Hotshots faces off with defending champion TNT Tropang Giga. And the long wait is over for Blinks as Blackpink finally announces the release of their new album. You're watching CNN Philippines.
Fried chicken? Timplang happy! With easy-to-cook Magnolia Chicken Timplados. Iba't ibang sarap ng chicken, kaya. Anong Magnolia Chicken Timplados mo? Iba't ibang easy chicken sarap.
It can be dangerous out there. Buti na lang there's locally superfruits. Para sa akin, super nutritious, super delicious. All superfruits contain more antioxidants than your average fruit. Superfruit for super you.
Pogino! Dahil yan sa vet-approved Nutri-Chunks Coat Shine. With active boost and prebiotics na pampalisto. Made with real salmon goodness and omega-3 and 6 for healthy skin and shiny coat. Kita naman, di ba? Listo, ganado sa Nutri-Chunks Coat Shine.
Tumagal tayo sa dilim, laman tayo ng nightlife. Now it's time to live the light life. Let's have Sandvik Light with the sun out. Hindi lang panggabi ang bonding natin. Any hour is now happy hour. As we drink up the light life, kumagaan ang feeling. Ang katapusan ng bawat kwento, may inuumpisa ang bago. Get into the light life.
Sunday night.
Welcome back to CNN Philippines. A happy homecoming for two Filipino-made Cube satellites that have ended their missions and landed back on Earth. Maya 3 and Maya 4 re-entered the atmosphere on August 4th and 8th, respectively. While in orbit for 10 months, the satellites transmitted amateur radio-based system beacons to 10 countries. The Stamina 4 space program leaders said Maya 3 and Maya 4 were pivotal in the local space industry's development. From welcome to goodbye, tennis superstar Serena Williams says in a Vogue article that she will evolve away from the sport after this year's U.S. Open. On Instagram, she said she will focus on being a mom. The news comes a day after the 40-year-old won her first singles match in 430 days at the Canadian Open. Serena is regarded as one of the greatest tennis players of all time, with 23 Grand Slam titles to her name. And rising NBA star Jalen Green reconnecting with his Filipino roots, coming back to the Philippines today. This is part of the JG4 Manila tour under sportswear brand Adidas Philippines. The Houston Rockets player is one of its ambassadors. The Ateneo Blue Eagles proving their might on the global stage, dominating a World University Basketball Series match by a whopping 86 points. The collegiate squad crushed Indonesian team Universitas Pelita Harapan yesterday 125-39 in Tokyo, Japan. Ateneo's game versus National Chengchi University in Taiwan is underway. It is official, 7'3" cager Kai Soto will suit up for Gilas Pilipinas for the fourth window of the 2023 FIBA Basketball World Cup Asian qualifiers. The Samahang Basketball ng Pilipinas says it's thankful for Soto's proactive response to the call to play for the flag.
Smart here, you see a jumper, nice touch from Kai Soto, open
And in the PBA Philippine Cup semifinals, the Meralco Bolts managed to tie the series again at 2 each. Meralco beat the San Miguel Beermen 111-97 at the Araneta Coliseum in Quezon City. And in another semi-series, TNT Tropang Giga is ahead in the first quarter of Game 4, 18-15. Tropang Giga holds a 2-1 lead over the Hotshots. Semifinals resume on Friday with TNT facing Magnolia at 3 p.m. and San Miguel playing against Meralco at 6. Members of the NU Lady Bulldogs speaking up after their shocking release from the national women's volleyball team that was supposed to compete at the AVC Women's Cup this month. Pauline Versosa tells us how the players are reacting to the sudden decision.
Shocking and painful. That's how players of National University described their sudden removal from the national women's volleyball team. In a letter dated August 7th, the Philippine National Volleyball Federation released all NU players who formed 12 of the 14-woman pool, citing that they may not perform at their best level due to restrictions and conditions that hinder training and overall program. This, despite the players already training for 3 weeks under national team head coach Jorge Souza de Brito for the AVC Women's Cup later this month.
So, nagulat po kami lahat. Sabi ko, ganun-ganun sa isang iglap, wala na para tayo sa national team. Parang after all, na lahat ng teams, tinalikuran yung invitation, tas kami, parang kinut short namin yung time namin with our families and friends, ganyan, para makapagpahinga after UAP. Para dito po sa national team. Tapos ganun lang din po yung mangyayari.
Players say the removal came immediately after they declined to play as a last-minute replacement for Japan in the semifinals of the Premier Volleyball League. The notice from the PNVF coming only 2 days before the tournament, raising concern among the Lady Bulldogs on their preparedness with their current training condition just at 70%, with some players still nursing injuries.
Para lang yun sa namin safety din. Parang syempre ibang level na yung lalaroan namin.
Yung AVC, iba't ibang bansa yung makakalaban namin. And hindi lang sila basta-basta players. So, kung hindi maayos yung preparation, di ba nga, sabi po nila, if you fail to prepare, you're prepared to fail. So, yun po yung kinakatakutan namin mangyari.
NUT manager Mariana C. Diet also stressed management simply acted upon the sentiments of their players with the welfare of the student athletes in mind.
I really don't know what they mean by restriction and condition, but the program was really 5 weeks for ABC, nothing in between. It's really written, it's Asian Volleyball Confederation Cup, so that's the expectation of all the team. May ano si Coach George na if you don't play for PBL, you cannot play for ABC. So siyempre, ito mga bata, iyak yan.
Players expressed dismay after pouring much time and effort, even answering the call of the national team when others begged off. For now, they say they just want to move forward and shift their focus back on their title retention bid in the UAAP.
Nakakasad lang po kasi parang hindi po na-appreciate siguro on our part, on our end, na lahat po ng effort. Tapos parang mali pa po namin.
Hindi naman matatapos yung volleyball sa ganitong sitwasyon. And let's just hope na things will get better.
In our heart, we really wanted to help the PNBF. To Mr. Susara, to the rest of the stakeholder of PNBF, we will still support you. 100% yan. PNBF. Ang hope ko lang, baguhin naman natin yung sistema at saka programa. Yun lang, baguhin lang talaga natin. Hindi tayo pwedeng ganito.
The eventual champions of the PVL will instead represent the flag in the ABC Women's Cup, taking place from August 21 to 29 at the Phil Sports Arena. Bolin Verzosa, CNN Philippines.
Speaking to CNN Philippines Sports Desk, the National Volleyball Federation President Ramon Tatsuzara commenting on the issue saying, quote, "When you lend your players to the national team, you must follow the plans and programs," unquote, adding that the Lady Bulldogs would play for the country if they really wanted to. And moving on to K-pop, time to set the date. Blink's Blackpink's second full album, Born Pink, is arriving on September 16th. This is the Kill This Love singer's first record in nearly 2 years. A pre-release single called Pink Venom comes out next Friday. And that is it for now. Join me again on news.ph at 7 p.m. and on Politics as usual at 8. I'm Pia Ontiveros for Newsnight, where we go above and beyond the headlines.
This program is brought to you by
BYKB Radio
Do you sometimes notice that you have blurry or cloudy vision despite wearing proper eyeglasses? Or do you have trouble seeing properly at night and are a bit more sensitive to light? Well, you may be starting to develop cataracts. Have no fear though, cataracts are pretty common and what's most important, they are treatable. On the program today, we'll talk about what causes this condition and ways to prevent as well as treat them. I'm Dr. Freddy Gomez and welcome to MedTalk Health Talk on CNN Philippines. When the lens in your eye, which is normally clear, starts to become foggy or cloudy, a cataract may be developing. Our guests are here today to tell us more about this condition. With us is Dr. Arnold Salud. He's an ophthalmologist and vitreoretina specialist from the Medical City and American Eye Center. Also with us is Dr. Edward Uy. He's an ophthalmologist and a cornea and external disease specialist from the Makati Medical Center. Thank you both for joining us on the show. Now, many people may develop cataracts over their lifetime. I'll start with Dr. Arnold. Common ba ang cataracts dito sa Pilipinas, Dr. Arnold?
There are several other causes, but the main cause is aging. So if we will take into consideration aging, it must be just about the same with any other country. But because there are other things that can cause early cataract formation, like diabetes, steroid use for other illnesses, trauma, because we have a very high case of diabetes here in the country, our incidence of cataract is much higher compared to others.
We'll talk more about some of the risk factors later on the show. And speaking of aging, more than 50% of people actually over the age of 50 is common to have developed cataracts. Now, most people start getting it around the age of 40, according to some of the statistics, but they don't really notice symptoms until after the age of 60. Now, the condition is a real concern for all of us as we get older. But there are some factors that can make you more likely to develop it. Now, Dr. Dado, who are more prone to having cataracts?
So first and foremost, the elderly population are at risk. So anyone 60 and up have a higher likelihood of developing a cataract. People who are medically not normal in the sense that they have a medical illness will be also more prone to get it earlier.
Now, Dr. Dado, we all know that smoking is linked to a lot of diseases, heart disease, lung disease, but some of the studies also show that it's also linked to some eye problems as well, including cataracts. Could you explain this a little bit for us?
So smoking affects the body in a way where no one really realizes how severe it can be. So if it affects the eye, usually cataract is one, macular degeneration is another.
Now, in fact, the United States Food and Drug Administration reported that people who smoke are 2 to 3 times more likely to develop cataracts. So quitting smoking cigarettes can significantly reduce your chances of developing it. Now, most cataracts are related to aging, as what was mentioned by our guests, but there are also some types that can develop during childhood or due to other health problems. Dr. Arnold, who else can be affected by cataracts, and how often does it occur in people below the age of 40?
When you're young, there's also what we call congenital cataract. So you can be born with it. And as mentioned, people might not notice that they are starting to have cataract, but that's the importance of seeing your doctor, especially if you have other illnesses in your body.
Dr. Arnold, let's touch on the trauma part a little bit that causes cataracts. Can something like corneal abrasions, like wearing contact lenses for long periods of time, can this be classified as a trauma that can lead to a cataract in the future?
Strictly speaking, no, because with corneal abrasion, you just touch the front part of your eye. Again, I always try to compare the eye with a camera. The cornea is the cover of the lens. So if you scratch it, there's no effect on the lens itself.
So whether it's because of aging or injury due to trauma, many will experience a cataract at some point at a certain age. And it's vital to understand its symptoms so that you can get proper treatment right away. When we return, we'll discuss the signs to watch out for. We're your partner in health, so keep it here on MedTalk Health Talk, only on CNN Philippines. I'm Dr. Freddy Gomez and welcome back to MedTalk Health Talk on CNN Philippines. More than 50% of people over the age of 80 may develop a cataract, and they occasionally occur in young people as well, but not that often. So it's when the lens of the eye becomes foggy or cloudy, which can lead to blurry vision or vision loss if it prolongs any further. Now, Dr. Dado, let's talk about what to expect at first when someone develops or starting to develop a cataract. Ano yung mga unang simptomas na mararamdaman ng isang tao?
Yeah, for people who don't wear glasses, they automatically will complain of their vision getting cloudy. For people with glasses, they will often feel that they need to change their glasses, even if they just replace their lenses recently. So your vision getting blurry, or if your glasses like getting foggy, that's the presentation of a patient with a cataract.
Dr. Dado, both eyes ba are affected at the same time when it comes to cataract, or is one eye usually affected first?
Usually, it's one eye affected first, but eventually the other eye will get the same symptom.
Now, eventually, the area of blurred vision is likely to grow as your lens becomes more and more cloudy. Now, Dr. Arnold, tell us more about the progression of the symptoms. And what is the time frame before we feel slight symptoms to a person's vision loss is already apparent?
We always describe to our patients that having cataract, we will have cloudy vision. And a lot of them find it hard in the beginning to accept that it's the cloudy vision that's disturbing them. Later on, it gets worse, like looking through a frosted glass. And that's quite late already.
The reason why I asked that, Dr. Arnold, because I think ugali sa mga Pilipino is titiisin hanggang kaya. So what is the best time? Is earlier better than later in this case when it comes to cataracts?
Well, to me, two things. We always discuss levels of cataract, but there's some form of subjectivity to it. No? An early cataract for one person may not be that early for another person. So at the end of the day, I think it all depends on the person himself or herself. No? If he or she feels that the quality of life has changed, then the cataract has to go. And the only way you'll find out really is if you visit your doctor.
Yes, that's true. To emphasize to our viewers, if you notice anything that changes and affects your quality of life, always have yourself checked. Dr. Dado, we talked a little about some of the risk factors, but let's go through some of the causes of cataracts. What was mentioned, of course, is diabetes, and having it can make you more vulnerable to cataracts. Tell us more about this, Dr. Dado. Is this a case of all diabetics, or are there certain parameters which may prompt someone who is suffering diabetes to develop cataracts?
It's more of those people who are undiagnosed diabetes, people who are diabetic, diagnosed but with poor control. The longer you're diagnosed with the disease, the higher the chance for you to develop a cataract. So diabetes in essence doesn't only affect the lens, it can also affect the retina. So some people would feel that their vision is changing, but in reality, sometimes it's not purely a cataract, but retinal disease. So they need to see their doctor for that.
With the case of cataracts, will someone feel any pain while a cataract is developing? Let's talk about that.
Basically, initially, probably just the glare to light, darkening of their normal vision, eventually blurring, but cataracts don't usually cause pain unless it's a very mature or hyper-mature cataract in elderly people and the angle of the eye closes and develops a glaucoma.
So that is true. So that is why if you have cataract symptoms, pain may not always be there, but please consult your doctor right away. Now, Dr. Arnold, walk us through how someone is properly diagnosed to have a cataract.
You can diagnose it two ways, by talking to your patient. And the best way really to diagnose it is the instruments that we use in our clinic. We have very specific instruments that can visualize the lens of the eye. And just looking at the lens, we can tell you if it has become cloudy already.
Now, Dr. Arnold, can cataracts be properly diagnosed kapag pumunta sa mall, dun sa paggawaan ng mga eyeglasses, or where do you recommend a person be properly diagnosed when it comes to cataracts?
Our partners are optometrists who handle the optical shops that you find in the mall. Okay, we would usually go there if we think that the eyeglasses that we wear are not functioning the way we want them to be. So it's either your grade has changed because you're growing older and your grade can actually change, or your vision is deteriorating because your lens is starting to become cloudy. So if that is the case, when your optometrist tries to get your grade via refraction, they'll find it hard. So eventually, they'll direct you to the friendly ophthalmologist as well.
Now, cataracts can and will worsen over time, so your doctor will most likely recommend surgery for the treatment. More on this when we return. Your health is our mission here on MedTalk Health Talk. You're watching CNN Philippines. I'm Dr. Freddy Gomez, and this is MedTalk Health Talk on CNN Philippines. Blurry vision is a telltale sign that a cataract might be developing. Now, while this can be mild and manageable, they tend to grow progressively worse, and they eventually interfere with daily activities like reading and driving and your overall quality of life. Now, Dr. Dado, earlier on the show, we talked about how cataracts are diagnosed. Now, let's talk about the treatment this time. A lot of our viewers, when they hear surgery, they always have some form of anxiety. So they always ask, pwede bang idaan sa gamot ang cataracts, Dr. Dado?
Not all cataracts needs a surgery right away. So for people who can still wait or they decide to wait and just be corrected with spectacles, that's their decision. But it's more of the patient being given the proper information for them to undergo the procedure safely.
Okay, so Dr. Dado, what you're saying is surgery is the best option when it comes to cataracts, but during the initial stages of an early cataract, yung medyo blurry pa lang ang vision, surgery can be held further down if corrective lenses can still compensate for that
It still helps.
blurriness. Is this also applicable for those, like what we talked about earlier, those who are younger than 40, those who have probably a genetic predisposition to cataracts? Does the treatment follow the same for them as well, Dr. Dado?
So for people with a genetic problem like developmental cataract, they usually get blurred vision slowly. So it's a slow progression to the eventual surgery. So if the patient can still wait, then we usually advise them to just be more worried about the symptoms of the glare to light and all that. But eventually, if the vision can't be fully corrected or helped with spectacles, then we advise surgery.
Now, Dr. Arnold, pag-usapan natin yung surgery mismo. Ang number one tanong dyan, masakit ba ito, Dr. Arnold?
Again, for our audience, there are several kinds of surgeries for your cataract, no? Yung naririnig po ng mga pasyente natin, it's not that painful, but compared to the newer technology is quite painless. May kanya-kanyang lamang po yan, but the common denominator would be it's not as painful as our patients imagine them.
Dr. Arnold, will those undergoing cataract surgery be able to see a drastic difference in the quality of life, in the level of vision that they can get back?
Definitely. There's an element of magic in it, in the sense that people come in with very cloudy, poor vision. They go home close to the vision that they will get in the next few days. They can see the difference already even prior to going home.
So cataract surgery now is much different than it was years before. Yan ang sinasabi ng mga guests natin. So the comfort level is much improved, as well as the level of improvement that you will get with your eyes. Now, Dr. Dado, pag-usapan naman natin ang recovery dito. What is the downtime for someone who has undergone cataract surgery?
People who undergo surgery, since it's topical anesthesia, they can usually see right away. So it's not something that they have to stay in the room for, they can't go out and all that. They just need to wear some protective goggles during the day to protect them from any possible trauma to the eye. And they usually see immediately well the next day. Usually the healing period is about a week or two, and then full healing in 6 weeks.
How long can that person go about by their daily activities, Dr. Dado?
For people with no strenuous activities, they can usually go to the office immediately the next day, although we still advise them to be really careful with regards to things that they read and if they need to carry something to the office because of possible trauma and something hitting their eye. But they can eventually start their normal activities the next day.
And Dr. Arnold, for someone who has gone through cataract surgery, should they be worried about the cataract recurring?
Cataract doesn't come back. Okay, so it's a one-time thing. Once removed, it doesn't come back. That question probably emanates from some patient experiencing that they get the blurry vision again months or years after cataract surgery. Basically, the lens that we place remains clear for the rest of their lives. There's something that happens on the bag, the thing that holds it, that makes it a little bit cloudy again, but gets fixed in a few seconds, that we laser eventually later on after surgery.
And Dr. Edward, we've explained thoroughly how the main risk factor of having cataracts is aging, but a lot of people may be wondering, meron bang kinakain ng isang tao that may lead them more prone to having cataracts? Does diet have a role in cataract formation?
With regards to food, probably not. But some people take something like a steroid to help them build up their muscles. Those medications like steroid can produce cataract early in a person's life. So we just need to be careful with regards to medications or anything that we take in, because sometimes we don't know the ill effects of what we take.
Now, before we go, I'd like to get some parting messages from the two of you. I'll start first with Dr. Arnold. Do you have any message for our viewers?
Cataract is inevitable because it's mainly because of aging. There are many other causes of cataract, specifically diabetes. So bottom line, take care of your health. Accept the fact that aging will cause cataract. Take care of your health so you don't develop it sooner than expected.
Very good. And of course, Dr. Dado, any parting message for our viewers?
Dr. Arnold and myself are here to help you. So doctors are not here to for you to be afraid of. So just a reminder for you to see your doctor so that we can help you with the cataract if ever you have one, for better vision and better quality of life.
And we definitely know more about cataracts today with this episode, thanks to the two of you. So thank you very much, Dr. Arnold Salud and Dr. Edward Uy, for being with us today and sharing your information with all of us. I'm Dr. Freddy Gomez, and thank you for watching MedTalk Health Talk. We'll see you again next time.